This is Wesley Richards with my Grand Rounds assignment. I have been trying for the last hour to figure out how to put a voiceover with this, and with everything else going on, I cannot figure it out, and I'm just at my wit's end. So here we go. A patient I saw in the emergency room, I'm doing my clinicals, was a 35-year-old female. She presented to the ED by a private vehicle. She had a complaint of painful urination, increased urinary frequency, and a fever for the past 3 days. Her allergies were penicillin and sulfa antibiotics, and my immediate concern, just coming from the emergency medicine background as a paramedic, was of course sepsis. Patient's past surgical history includes a tonsillectomy performed in 1997 due to frequent ear infections. Said she went through a long bout in her childhood of otitis media, and had the tubes inserted but didn't offer any relief, and they just went with a tonsillectomy. In 1997, says she has not had a recurrence of earache since. And she had a hysterectomy done in 2011 following the birth of her first son. She opted to do this as when she was giving birth, she said they had found some nodules on her uterus, so she elected to have the hysterectomy done in 2011. She's para 1, gravida 1. Stated her pregnancy had no complications. Her son was delivered vaginally. No post complications. Her pertinent family history, as her father suffered a CVA in 2016. She states he made, what she said in her words was almost a full recovery. He has some right side deficit with his right arm apparently, and at times for like long walks requires a cane. He is treated both then and now for hypertension and coronary artery disease. Her mother, who I did not get to meet that night, but she stated she's treated for hypertension and she's a type 2 diabetic, which controlled medicine via metformin. Patient she takes medications for depression, anxiety, and her birth control. She states she's always been on the same antidepressant, which is sertraline, 100 milligrams daily. She's always been on the same anxiolytic, which is Ativan, 4 milligrams. She stated daily, and I think she was somewhat unclear between daily and PRN. She was in a lot of pain, so I didn't want to press too much on that issue at the time. She states she has had one UTI in the past during her pregnancy. States it was treated with antibiotics. She couldn't remember the name of the antibiotic, but states there was really no complications long term. States she works in insurance sales for Geico full time. She has for 4 years. States she works 40 hours a week. She likes where she works. No stress really coming off the job. She denies any present or previous history of smoking, alcohol use, or illicit drug use. She was very adamant about that, so didn't press on that. Denies any SI or HI. So she lives in a townhouse with her boyfriend of 6 years. They have a son, the one who is 6 years old. Patient denies any history of abuse and says she feels safe where she lives. And there's a typo right there, so I will go ahead and fix that right in front of you. Her vital signs. Vital signs are pretty stable. Nothing indicative of leading towards SIRS or sepsis, so that was very good. Blood pressure was 121/66, heart rate of 74. Respiratory rate was 18, regular, non-labored. SpO2 was 100% on room air. Temperature was 100.6 oral, so that was the one thing that stood out. Pain score is 5 on a 1 to 10 scale. She states she has a high pain tolerance, so that could be 7 or 8 for you or me. Patient states the pain is centralized to her vaginal area. It's just on urination. Says she gets uncomfortable when she sits at her desk, but it actually has the burning sensation when she urinates. There was no reason the patient was at fall risk at the time of her ER arrival. Her general physical exam was patient ANO 4, GCS 15. Her airway was patent, breathing was non-labored, pulse is present and regular. Capillary refill time is 2 seconds. Her skin was pink, warm, and moist. She was not diaphoretic, however, she was, in layman's terms, she was sweaty. So, likely due to, the pain and the fever. So, to be expected, pupils were pearl, lung sounds are clear and present in all fields. Her abdomen was soft, non-tender, with bowel sounds present in all quadrants. And the provider did not choose to provide, or not perform, a vaginal exam. I don't know why. I didn't get a chance to ask him, but that was not performed. I did an EKG on the patient, normal sinus rhythm, no ectopy or ischemia, no ST, depression, elevation, no, PVCs, nothing like that. So cardiac was rolling out pretty quickly. IV access was obtained by me, 18 gauge, if I remember correctly, right AC. Blood labs were drawn, CBC, CMP, and a lactic. Blood corpuscles were also drawn, sent to the lab. She was not happy about the, getting a second stick with the butterfly, but it, has to be done. Urinalysis obviously was also completed. We had a point of care and a clean catch with a reflex. Her CBC did show elevated white blood cell count, which should be expected, and an elevated segmented neutrophil count. Blood cultures came back positive for bacterial growth. I was unable to get the information about what bacteria it was because they kind of keep lab down in the basement. And, I needed a chance to talk to them, although I would have liked to have known that. The UA showed an alkaloid pH, presence of bacteria, and along with cloudy character. It was dark. There wasn't really an option for that. The closest it was to straw colored, but it was a little bit darker than that. Current medications, the sertraline, 100 milligram once a day for depression. Patient says she takes it in the morning, so it doesn't keep her up all night, which I have heard that from other people as well. Ativan, 4 milligrams a day. I'm just going by her words for anxiety. She's educated to mind it with alcohol, and she takes it as needed. So there was a little bit of confusion there, I think, with like PRN as opposed to a day as needed. Maybe she takes it once a day. I don't know. But like I said, she was there for other reasons, and I don't want to complicate matters. She takes Brevicon. That was the name of her birth control pill. Says she's been on that for years with no complications. 0.5 milligrams once a day is a contraceptive. She doesn't feel any of her current meds are contributing to her factors and her current chief complaint. She was kind of, at this point, I think, getting annoyed with me that I was asking these questions and not strictly pertaining to her chief complaint, which is understandable. So I didn't press anything too hard. She states that she has never completed or participated in any therapies. I wasn't trying to. She was, with the hospital wait time, she was growing a little impatient, which is understandable. She was in pain. So when I asked about psychotherapy as therapy, because she was on sertraline, says she went to a single session a few years ago, but it just wasn't for her. So again, I didn't press any further. I was there. I actually did a discharge. There was no referrals to any specialists. And my patient education, the standard patient education, took out her IV, did her vital signs, and I educated her upon discharge for her reason for visit, her chief complaint, and the provider's diagnosis, what tests we did, and what medications were given and prescribed. Went over her prescription for doxycycline, 2 tablets a day for 10 days. Definitely educated the patient to finish the entire regimen. Don't just stop when you feel better, things like that. Told her to return to the ER via by private car or ambulance for worsening pain, increasing temperature, or for any new complaints. Made sure to go through telling her to stay well hydrated and avoid any high sugar, high foods, because bacteria kind of feeds on that sugar. And that was it. Pretty simple case, but perfect for a nursing student like me.